Hello, and welcome to this PowerPoint title, I'm Pregnant, What's My Next Step? To get to know us a little better, here are some of the services offered at the Perinatal Referential Service for Immigrant Women. Establish personalized meeting for immigrant mothers, relay moms. Explain and differentiate the different care networks, health, community, or private. Host group meetings such as sewing group, baby wearing classes, etc., to avoid isolation. Provide material assistance based on donations received at the headquarters. Offer emergency child care services during labor. What you will find in this PowerPoint: pregnancy for follow-up appointment in Quebec. Who can do pregnancy follow-up appointments? Preparation classes on childbirth, community resources, your rights while being pregnant, RAMQ financial coverage, interim federal health program, and costs. Pregnancy follow-up appointments in Quebec City. First trimester, average of one appointment. The first appointment is around the 10th week of pregnancy. Second trimester, an average of 3 appointments. You should expect to have an appointment every 4 weeks between your 12th to 28th week of pregnancy. Third trimester, average of 8 appointments. You should expect to have an appointment every second week between your 28th to your 36th week of pregnancy. Before birth, you can expect to have an appointment weekly from your 36th week of pregnancy until labor. Who can assist you during your pregnancy in Quebec? Follow-up appointments with the doctor. Family doctors will do follow-up appointments only. Practitioners specialized in perinatal care and gynecologists will do the follow-up appointments as well as labor and delivery. How to find a doctor. Register online with Quebec Family Doctor Finder. Important to mention that the waiting period could be longer than expected. Look up the Association for Practitioners Specialized in Perinatal Care of Quebec. Find an obstetrician gynecologist. Contact medical clinics for family medicine groups, FMG, near you to ask if they accept new patients. It is ideal to know the date of your last menstrual period. Follow-up appointment with the PCNP, Primary Care Nurse Practitioner, also called Super Nurse. A PCNP, with the collaboration of a doctor, will do pregnancy follow-up appointments. The follow-up appointments are done based on a pre-established plan created by the two healthcare professionals. The doctor will be assisting during the second appointment as well as the one at 32 weeks of pregnancy. Labor and delivery in a hospital. Hôpital Saint-François d'Assise, Schul Mother and Child Care Center. With a midwife. The midwife philosophy considers pregnancy and childbirth to be a normal physiological process with deep meanings in the lives of women and families. Thus, the midwife takes the time to discuss any subject that concerns the couple. The follow-up is adapted, secure, and respectful of each person's value. Different options for your labor and delivery with a midwife. At home, birthing center, or hospital. Complete an independent follow-up with the midwife in a birthing home, as well as for a home delivery from the beginning of pregnancy until 6 weeks after delivery. The birthing homes are Birthing Home in Limoilou, Quebec, or Birthing Home Mimosa in Lévis. Services available in birthing homes: pregnancy follow-up appointments, prenatal and breastfeeding classes, choice of labor and delivery, postnatal follow-up appointments, help with breastfeeding. Healthcare system in Quebec. CIUS, Integrated University Center of Health and Social Services. CLSC, Local Center for Community Services. Prenatal classes are offered by CLSC. Community organization may be at your own expenses. Online capsules from CIUS. How to prepare for childbirth. Preparation classes on labor, alternative medicine, prenatal activities, birth support such as doula, natal plan. Services offered from CLSC: free pregnancy tests, prenatal clinic, OLO program, SIP program, prenatal classes. OLO Foundation Healthy Babies. They will provide free supplies of eggs, milk, orange juice, vitamins and mineral supplements, as well as nutritional counseling. It is destined to families in a vulnerable financial situation because eating healthy will support you during pregnancy as well as your baby's growth and development. SIP, Integrated Perinatal and Early Childhood Services, will support you from the 4th week of pregnancy until your child is 5 years old. It is a program for future or new parents living in with financial difficulties and where one of the two situations may apply. Someone who doesn't have a high school or professional diploma, someone who feels alone or isolated. Natural medicines are natural therapy, physiotherapy, osteopathy, acupuncture, massage therapy. Those services aren't covered by the RAMQ or the Interim Federal Health Program. Birth companions, aka doulas, an experienced person passionate by the birthing process who is trained to offer physical and emotional support mainly during labor, delivery, and the postnatal period. This type of service is not covered by the RAMQ or the Interim Federal Health Program. Other beneficial activities during pregnancy are prenatal yoga, aqua fitness, swimming, walking, prenatal singing, etc. Birth plan. Thinking about what might scare you? What type of labor and delivery do you wish to experience? What kind of pain management techniques would you like to try? How do you wish your postnatal period to look like? The birth plan is meant to help the medical team to know you and your wishes and preferences during labor and delivery. You must remember, though, to remain open and flexible since childbirth can be quite unpredictable. As any other patient, a pregnant woman has rights that must be respected by the medical staff. Do you know what they are? During pregnancy, you have the right to be adequately informed about the process of your pregnancy, labor, delivery, and breastfeeding. Choose the professional who will assist you during your pregnancy, whether it's a doctor or a midwife, and have the possibility of changing professionals regardless of the progress of your pregnancy. Be informed about the different places of birth, hospital, birth center, or your home, about what categorizes them, routines, regulations, rates, and type of interventions, and to visit them. To be informed of the limitations and adverse effects of suggested medication and interventions. During pregnancy, you have the right to refuse medication and treatment offered to you, obtain alternatives to regular medication and interventions from your professional, be informed about the possibility for you to have a vaginal delivery, even if you have already had a cesarean section, aka VBAC. Seek, if necessary, the second opinion of a professional regarding any questions you may have. Costs of pregnancy, monitoring, and childbirth in Quebec. If you are covered by RAMQ or Quebec's health insurance, the costs related to pregnancy, monitoring, and childbirth are free. There will be a waiver of the 3-month waiting period as well. Who is covered by RAMQ, Quebec's health insurance? Canadian citizen, permanent resident, such as economic immigrant, family reunification, refugee. Temporary residents, foreign student whose country of origin has an agreement with RAMQ, Social Security Agreement. Foreign workers with close permit for more than 6 months. Foreign workers with a post-graduation work permit, and agricultural workers. Who is not covered by RAMQ? Foreign students whose country of origin does not have an agreement with the RAMQ. Temporary foreign workers, open or closed permit less than 6 months old. Asylum seekers, immigrants in an irregular situation without status, and visitors. Interim Federal Health Program provides limited, temporary health care coverage to certain groups of people in Canada who do not have provincial, territorial, or private health insurance coverage. Costs with a doctor. Pregnancy follow-up appointments, 12 appointments, will vary between $1,500 to $3,000. And with a practitioner specialized in perinatal care, it will be $2,700 for a vaginal delivery and $4,600 for a cesarean section. Hospital stay for 2 days will range between $5,000 to $10,000. The total cost for pregnancy, labor, and delivery without complication will range between $9,000 to $17,000. The cost with a midwife will range between $3,500 to $12,000, including pregnancy follow-up appointments, about 12 appointments, giving birth, postnatal follow-up appointments, about 5 to 6 appointments. Extra fees will be for the ultrasound, different analysis like urine tests, blood tests, gestational diabetes, etc., and emergency transfer to a hospital. Tests and checkups. Prenatal appointments for one appointment will range between $125 to $250. Analysis like blood tests and various screening will range between $450 to $600. Ultrasound will vary between $150 to $300. Pediatrician, who it applies to, when do you need to set an appointment? Pediatricians are doctors specialized in the health of children from birth until adulthood, 18 years of age. They also ensure a continued follow-up until adulthood on more complex health-related problems. CNIS, Organization for Labor, Security, and Equity, a program to promote a pregnancy without danger or harm to the mother and child. The purpose? Secure the position of a person while pregnant or breastfeeding that may cause physical harm to either or both the mother and child. There's two options: either be assigned to another position or other task, or going on a preventive leave, in which case the person on a preventive leave will receive a compensation of 90% of salary up to the date of an assignment or up to the fourth week before the expected due date. DPJ, Department of Youth Protection, upholding children's rights 18 years old and younger, intervenes in situations that may compromise a child's safety or development, obligation to help the parent so that the child can continue to live in its family environment in an adequate way. La Place 05, Daycare Placement, online registration to Quebec's daycare services. It is ideal to register your child as soon as possible during pregnancy to secure a spot for your child as early as possible, because the waiting period may take longer depending on your area. Your options are CPR or Early Childhood Center, family daycare, or private daycare service. Community resources. If you have any other questions, feel free to contact us at the Perinatal Referential Service for Immigrant Women of Quebec. Thank you for listening.